Lesson 2. Basic mandibular movement. Nature has blessed us with a marvelously dynamic masticatory system, allowing us to function and therefore exist. Mandibular movement is complex. It involves series of interrelated three-dimensional activities and determined by both temporomandibular joints. In this presentation, we will isolate and discuss the type of mandibular movements that occur in a single TMJ, to better understand the mandibular movement's complexities. Please bear in mind that TMJ cannot function entirely independent of each other. There are a few important factors that can influence mandibular movement. One is temporomandibular joint. Second is teeth factor. And third is neuromuscular and ligaments. Generally, temporomandibular joint consists of articulations between three surfaces: the mandibular fossa, articular tubercle, from the squamous part of the temporal bone, and the head of mandible. And the articular disc itself is made of fibrous tissue which divides the joint cavity into upper and lower compartment. In healthy TMJ and when the teeth are in maximum intercuspation, head of condyle is located in the supero-anterior position of the fossa with the articular disc interposed. This slide further describes the condyle position during the initial stage of opening and also during the maximum opening of mandible. Again, in a healthy joint, the condyle is in a supero-anterior position of the fossa with the articular disc interposed when the teeth are in maximum intercuspation. In the initial stage of opening, the condyle rotates in position, with the disc remaining stationary, while during maximum opening, the condyle translates forward, with the disc still interposed. How about in dysfunctional TMJ? In a dysfunctional joint, the condyle usually is displaced posterior to the disc at the intercuspal position. After initial rotational opening, the condyle is still posterior to the disc. And in translation of the mandible to maximum opening, the condyle recapture the articular disc, clicking into position as in C. Basically, there are two types of basic mandibular movement which occur in the temporomandibular joint. One is rotational movement and the other one is translational movement.
Dorland's Medical Dictionary defines rotation as the process of turning around an axis, movement of a body about its axis. An axis is a fixed straight imaginary line which an object may rotate. The rotational movement can occur in all three planes: horizontal, vertical and sagittal plane. Mandibular movement around the horizontal axis is the opening and closing, which refers to hinged movement. And this is the only example of pure rotational movement, as rotational movement around other axis is accompanied by translation of the axis.
Rotational movement can occur in all three axes of planes: horizontal, frontal, vertical and sagittal. Coronal/frontal/vertical plane divides the body into front and back section. Sagittal plane divides the body into left and right sections. Horizontal/axial/transverse plane divides the body onto upper and lower segment. During mastication, when mouth opens and closes around an axis, fixed point within the condyle, hinged, pure rotational movement takes place. And because it occurs around a fixed horizontal point, there is no changes in condylar position, the head of condyle only rotates within the inferior cavity of the joint. As a conclusion, rotational movement 1. Occurs when mandible makes a hinged movement within a 20 to 25 mm separation of anterior teeth. 2. There is no positional change of the condyle. 3. Pure rotational movement is when the mandible open and close around horizontal axis. Mosby Dental Dictionary define translation as a movement of a rigid body in which all parts move in the same direction at the same speed. Translational movement of mandible occurs when there is a bodily movement of head of condyle. This happens when mandible protrude, moves laterally or maximally open, more than 25 mm anterior teeth apart, causing the teeth, head of the condyle and rami moving in the same direction and to the same degree. Positional change of condyle takes place during translational movement. As a conclusion, translational movement occurs when mandible protrude, moves laterally and open wide, more than 25 mm apart. And during this movement, positional change of the head of condyle takes place. Now let's see what muscles involved during mastication. There are four main muscles of mastication: master, temporalis, medial, pterygoid and lateral pterygoid. Embryologically, they develop from the first. Pharyngeal arch and all are innervated by a mandibular division of the trigeminal nerve. All the four muscles are elevators except the lateral pterygoid muscle, which acts as a depressor muscle. Now let's see the muscle individually. The first one is temporalis. The temporalis is a large, fan-shaped muscle that originates from the temporal fossa and the lateral surface of the skull. Its anterior fibers elevate the mandible, causing mandible to close, and its posterior fibers retract the mandible, causing the mandible to retrude. The masseter is a rectangular muscle that originates from the zygomatic arch and extends downward to the lateral aspect of the lower border of the ramus of the mandible. Its superficial fibers protract the mandible while its deep fibers elevate the mandible. The medial or internal pterygoid muscle originates from the pterygoid fossa and extends downward, backward and outward to insert along the medial surface of the mandibular angle. When its fibers contract, the mandible is elevated and teeth brought into contact. Unilateral contraction of these fibers will bring about a medial-intrusive movement of the mandible. For many years, the lateral or external pterygoid was described as having two distinct portions or bellies, an inferior and a superior. These two bellies of the lateral pterygoid function quite differently. You can refer to Lesson 1 for more details on muscle of mastication.